we will discuss the top 7 causes of upper middle stomach pain. This type of pain is also called epigastric pain. The middle upper part is located just below the ribcage, in the middle of the stomach, and above the belly button. The most common cause of such pain is acid reflux, also known as gastroesophageal reflux disease. This condition is most known for its heartburn symptom. It means a person experiences a sensation of burning in the chest or throat, which worsens after eating or when lying down. People may also complain of regurgitation, a sour, bitter taste in the mouth due to acid backing up into the throat. The chest pain may resemble a heart attack, but it is usually related to meals and feels more burning in nature. People with chronic acid reflux may also experience a dry cough, a sensation of a lump in the throat, and hoarseness or a sore throat, because the acid can irritate the vocal cords. If we focus on the hallmarks or most important signs of acid reflux, it would be heartburn, which worsens after eating large meals, spicy or acidic foods, or when lying down. Fatty foods like pizza, French fries, and fried chicken commonly worsen GERD. Fruits like lemon, orange, and grapefruit can also trigger symptoms. Drinks such as coffee and colas are known triggers. The main cause of acid reflux is a weak or dysfunctional or esophageal sphincter with C. When the LS fails to close properly after food passes into the stomach, it allows acid to reflux into the esophagus. Obesity is a major risk factor for GERD because fat puts pressure on the stomach and weakens the esophageal sphincter. Caffeine-containing and fatty foods, along with smoking, increase the risk. Certain medications like non-steroidal anti-inflammatory drugs, calcium channel blockers, and anticholinergics can also cause GERD symptoms. To treat GERD, it is important to avoid trigger foods, eat small meals, and elevate the head of the bed by 6 to 8 inches. Avoid lying down after meals for at least 3 hours. Weight loss and quitting smoking are also crucial steps. From medications, antacids are effective in neutralizing stomach acid for quick relief. Examples include Myalox and TUMS. For mild cases, H2 blockers like ranitidine and famotidine can be used. For long-term treatment, proton pump inhibitors like omeprazole and lansoprazole are effective. Some studies suggest that melatonin is beneficial when combined with proton pump inhibitors. The second most common cause of epigastric pain is gastritis, which is an inflammation of the stomach. It usually occurs due to a bacterial infection called Helicobacter pylori. Gastritis pain is usually mild, burning, or just a general discomfort in the abdomen. It is often more diffuse throughout the upper abdomen. Another common sign of gastritis is nausea, bloating, a feeling of fullness after eating, and loss of appetite in many cases. Symptoms worsen with the intake of alcohol, caffeine, or spicy foods. Gastritis is very common, especially when people take non-steroid anti-inflammatory drugs like aspirin and ibuprofen, which are independent risk factors for gastritis. Many people may have gastritis without focusing on their symptoms and may not seek treatment. The third most common cause is gastric ulcer and duodenal ulcer, which are commonly referred to as peptic ulcers. The pain from a gastric ulcer is often similar to gastritis, but the difference is in the localized erosion and deep damage of the stomach lining, as opposed to diffuse inflammation. The same holds true for duodenal ulcers, but these occur in the first part of the duodenum. The gastric ulcer typically causes pain after eating, usually within 15 to 30 minutes, and can last for several hours, sometimes less. This is because food irritates the ulcer, causing further pain. In contrast with duodenal ulcers, eating can actually relieve the pain, but the pain usually returns 2 to 3 hours later. This explains why duodenal ulcers can cause night pain, and people may eat at night to relieve the discomfort, which can lead to weight gain. It is important to pay attention to gastric ulcers and gastritis as they increase the risk of gastric cancer. The gold standard for diagnosing gastritis and peptic ulcers is an endoscopy with biopsy, which assesses the level of inflammation and rules out Helicobacter pylori infection or malignancy.
The treatment for gastritis and ulcers is quite similar, especially in the first-line treatment. Typically, proton pump inhibitors such as omeprazole or pantoprazole are used. If Helicobacter pylori infection is present, antibiotics are necessary for eradication. It is important to avoid irritants like non-steroidal drugs and alcohol. Antacids and H2 blockers can also be used for additional pain relief. The fourth most common cause of epigastric pain is pancreatitis, which is the inflammation of the pancreas. Pancreatitis causes severe epigastric pain, often described as one of the most intense pains ever experienced, with patients rating it a 10 out of 10 on the pain scale. The pain is usually sharp and stabbing, but sometimes burning, located just below the ribcage in the center and can radiate into the back. Nausea and vomiting are common during pancreatitis, but unlike other conditions, the person does not find relief after vomiting. Tachycardia, increased heart rate, and low blood pressure can also occur, and jaundice, yellowing of the skin and eyes may develop if the bile ducts are blocked.
Abdominal area becomes sensitive to touch, and the pain increases when lying down, but it improves when sitting up and leaning forward. The pain is constant, severe, and usually lasts for days. In chronic cases, the pain can last for weeks, though it tends to be less intense. The pain often starts suddenly, especially after consuming a fatty meal or alcohol in chronic cases. Pancreatitis can be life-threatening in some cases, although most are mild. On the other hand, chronic pancreatitis is common among heavy drinkers. Gallstones are the most common cause of acute pancreatitis, as they block the pancreatic duct, leading to inflammation. Elevated serum amylase and lipase levels are the hallmark lab findings in acute pancreatitis, with lipase being more specific to pancreatic inflammation. These cases of acute pancreatitis require hospitalization. In severe cases, it can lead to pancreatic necrosis, infection, or multi-organ failure. Chronic pancreatitis increases the risk of developing pancreatic cancer. Myocardial infarction heart attack is another important condition to consider during epigastric pain. However, during a heart attack, the person usually describes chest pain with a sensation of pressure, squeezing, or tightness. The patient may also mention a burning sensation, but it is usually located in the chest. The pain often radiates into the jaw, left arm, shoulder, or back. In older adults, it may manifest as epigastric pain, which can easily be mistaken for indigestion. Additionally, profuse sweating of diaphoresis is common during a heart attack. XGG findings such as their segment elevation, depression, or T-wave inversion can indicate an infarction. Elevated cardiac enzyme levels, including troponin and creatine phosphokinase MB fraction, signal heart muscle damage. Coronary angiography is the gold standard for identifying blockages in the coronary arteries and is essential for diagnosis and treatment planning. The sixth cause of epigastric pain is a hiatal hernia, which occurs when the stomach pushes up through the diaphragm into the chest. Normally, the stomach should remain in the abdominal cavity, but in this condition it moves through a diaphragm hole. People with a hiatal hernia often experience GERD-like symptoms and may feel like food is stuck in the chest. In cases of large hernias, shortness of breath is common as the stomach presses against the lungs, making it hard to breathe. An endoscopy is crucial for diagnosing a hiatal hernia. The treatment is similar to GERD treatment, but in severe cases, surgery may be required. 40% of GERD cases are not due to hiatal hernia, as less than 5% of GERD cases are related to this condition. Lastly, the seventh cause, though rare but very important, is an aortic aneurysm, the aortic aneurysm. This is a bulging or weak area in the wall of the aorta, the largest blood vessel in the body. A ruptured aortic aneurysm is a medical emergency that occurs when this bulge bursts, leading to life-threatening bleeding. Although rare, aortic aneurysms are more common in men over the age of 60, especially those with high blood pressure, a smoking history, or a family history of aneurysms. Symptoms include sudden pain, typically in the back or abdomen, often described as severe tearing or ripping pain. Due to severe bleeding, shock or loss of consciousness may occur. Emergency surgery is required as the mortality rate is very high without immediate treatment.